The headlines. Malawi Society of Medical Doctors support AstraZeneca vaccine administration. Clusters under COVID-19 response initiative present 6.2 billion kwacha funds expenditure reports. Lower Shire residents decry crops wilting due to prolonged dry spells. In sports, Farm says its affiliates should adapt to the use of modern technology in the management of the sport. The Society of Medical Doctors has backed government decision to roll out bringing the AstraZeneca vaccine in the country, despite South African government putting it on hold due to its efficacy, which is at around 22%, according to reports. SMD President Dr. Victor Miti, however, says they are monitoring reports about it and they will make recommendations. Meanwhile, Medical Council of Malawi Acting Registrar Richard Ndovi has condemned continued attacks on health workers, a development he says is being perpetrated by the spreading of false information. Our reporter Andrew Viano has filed a report.
Debate around the effectiveness of UK's AstraZeneca vaccine has taken a new twist after South Africa put its administration to citizens on hold. Emerging concern is that it does not do so well with a new variant of the coronavirus found in the country. The vaccine is still under development. Experts in Malawi say they are monitoring trends on efficacy and would help make recommendation at a later stage. President of the Society of Medical Doctors in Malawi, Dr. Victor Miti, says the country should not hesitate to use the vaccine once available because in its current form it can still save lives.
We know that this vaccine has, to some extent, abilities of preventing people from developing severe cases, severe diseases. And we know that many people that are dying, they die because of severe disease. So it is from this angle, that's why we're still bold enough to say there's no harm in us trying this vaccine. You have to understand that we're in dilemma, we're in a very critical situation here. Even if the vaccine can save 2 lives, it is worth it trying than losing those lives. That's why for now we believe that there's nothing that we will lose in having this vaccine. But that doesn't necessarily mean that we will stop analyzing the disease pattern within our setting. It doesn't necessarily mean that when the vaccine is in our land, we'll just give it without observing. All those things will be followed.
Malawi is expected to receive a batch of the AstraZeneca vaccine this month end.
13 clusters under the COVID-19 Crisis Response Initiative on Tuesday presented expenditure reports of the 6.2 billion kwacha funds meant to fight the pandemic in the country. This followed a deadline set by President Lazarus Chakwera that all controlling officers submit the reports or risk losing their jobs. Contents of the reports have not been made public and journalists were kept out. The Human Resource for Health Coalition of Malawi has warned that it will withdraw its front workers from responding to COVID-19 if communities continue to harass them. Chairperson for the coalition, Shouts Semenza, was reacting to reports that healthcare workers are being harassed in the line of duty while ferrying COVID-19 dead bodies to their respective areas across the country for burial. Now, Minister of Health Kumbizeka Chiponda has advised managers of public health facilities to always ensure that they are exemplary to communities on promotion of good sanitation, which is key in prevention of diseases. Minister Kandodo Chiponda said this when she paid a surprise visit to Area 25 Health Center in Lilongwe on Tuesday, where she condemned poor sanitation and learned that crucial pain relief drugs such as Panadol are out of stock. However, senior nursing officer at the health center, Modesta Nyando, attributed lack of cleanliness at the facility to shortage of staff.
Minister of Health Kumbizeka Chiponda was concerned during her surprise visit to Area 25 Health Center in Lilongwe after observing poor sanitation in a number of rooms. Used face masks and parts of used injection syringes were found dumped in some of the corridors at the facility. The minister told health officials to find lasting solutions to the challenge.
Somewhere it has to be clean. We don't want the patient to come, then they end up getting some other diseases because of the environment of our hospital. So I've talked to them that they need to improve on this. We cannot have a hospital, where not even mopping, simple things, just mopping, it makes a big difference.
Kwagwanji Ndodo Chiponda also learned that essential pain relief drugs such as Panadol are out of stock at the facility. However, some services in departments such as the maternity section were intact. Senior nursing officer at the health center, Modesta Nyando, said poor sanitation at the facility is due to shortage of staff.
We only have 2 hospital attendants who are working in this department, and it's a huge department. And also apart from cleaning, they also assist with other activities of the facility. Area
25 Health Center has over 200,000 people in its catchment area. This is Winston Kaimira for Zodiac in Lilongwe.
The Evangelical Association of Malawi, EAM, says empowering girls by way of training them in various vocational skills is a sure way of ending child marriages in the country. EAM Programs Officer for Stop Child Marriage Project, Amos Chibwana, told us if girls are empowered at a tender age to be self-reliant, they cannot be forced into marriages. About 307 young people in GC have been trained in vocational skills by EAM, the Dan Church Aid, Tiveta and Press Trust in efforts to end child marriages, which are on the increase in the district. The High Court has granted permission for a judicial review on a decision by the Ministries of Health and Education to send home boarders at Kalibu Academy. Apart from the order for judicial review granted after an application by Fatima and other students and parents of boarding students at the school, the court has also issued a stay order against sending back students who are to sit for examinations at the school. You're watching the news here on Zodiac. We'll be back shortly after this.
Precious things have a secret formula. While John is busy trying to impress, James discovered Tangu's secret. Tangu uses Purity sanitary products from Purity body wash, Purity hands wash, Purity body lotion to Purity dishwash. After a week of using Purity sanitary products, James won the heart of Tangu. Use Purity sanitary products.
As we work hard every day to serve our customers and grow our business, one thing should always come to mind. You cannot do business without your customers. COVID-19 is amongst us and is quickly claiming the lives of our loved ones. As part of our corporate social responsibility, we have decided to forgo our part of revenue on Safe Hands Premium Hand Sanitizer to help stop the spread of COVID-19. Safe Hands Premium Hand Sanitizer is now available at Metro, Spar, People Supermarket in Lilongwe, Blantyre, Zomba and Mzuzu. Safe Hands Premium Hand Sanitizer comes in 5 liters. Beat the coronavirus. Use Safe Hands Hand Sanitizer. Ethco. That's the spirit.
Kodi ndinu nomwe somuzitichwa olemegezeka kwadi?
Koma mwache Eduardo. Nakatobwera nazo ndalama zanozi.
Oh.
Mbona kuchedo?
Kungoti ndadzera ku Audible. Ndimakasiya mafomu ofotokoza za chuma, mabusiness komanso za ngongole zimene ndili nazo. Anzathu munakaulula kale ngati?
Ayi. Komanso ndinezoulula zimangoona ngati mkungotcherana misampha chabe.
Kutcherana misampha kotani?
Olemekezeka.
Inu chuma choti mwachipeza mwachilungamo ungachite mantha? Kapena tumwina mufuna mutapeza chuma chanu kudzera munjira zosalongosoka koma pogwiritsa ntchito dindo wanu.
Yeso sichoncho.
Mwinatu. Chifukwa to ineyo ngati MP. Inunso ngati munthu amene muli ndi udindo kuboma. Tinayenera kuulula chuma chathu, mabusiness athu ku Audible. Tisachite kudikira kuti mpaka nati kumbutse yayi. Komanso anthu amene ine ndimatumikira anayenera kukhala ndi chikhulupiriro mwa ineyo.
Zoona.
Yetu. Mpaka na maina athu mpaka nati chiti discipline.
Sizabwino.
Ndipanga zomwezo komanso ndizawuza koso anzanga yena.
Akuluakulu ogwira ntchito zaboma kandi fama udindo ochita kusankhidwa ndi anthu kapena ndifo ochita kulembedwa tikuyenera kuulula chuma ngongole komanso mabizinesi omwe tili nawo ku Audible kuti tipewe kuyimbidwa mlandu kuyimitsidwa kapena kuchosedwa ntchito kumene. Uthengawo ukukufikani kuchokera ku Office of the Director of Public Officers Declarations, Audible.
If there's one thing that all soaps do, it's wash. From buckets to basins, bathrooms to streams, and everything in between.
All soaps wash.
Yes, but Protex is different. Its reinvented formula with flaxseed oil boosts your skin's natural anti-germ defenses by 10 times more, protecting you against 99.9% of germs. So what keeps us healthy?
Protex!
Good health starts here.
Welcome back. You're with me, Job Frank Chakaza. Before we continue with the news, let's look at the headlines one more time. Malawi Society of Medical Doctors support AstraZeneca vaccine administration. Clusters under COVID-19 response initiative present 6.2 billion kwacha funds expenditure reports. Lower Shire residents decry crops wilting due to prolonged dry spells. In sports, FAM says its affiliates should adapt to the use of modern technology in the management of the sport. Moving on with the news, people in Lower Shire have pleaded with government to provide them with long-term measures for survival, as most of their crops have wilted due to prolonged dry spells. Traditional Authority in Dakwera and Chairperson of Chikwawa District Council, Councillor Gerald Bede, has told Zodiac Tuesday that government should establish small and medium irrigation facilities as they wait for the completion of the Shire Valley Transformation Program. Minister of Agriculture spokesperson Gresham Lungu says the ministry intends to rehabilitate 5 irrigation schemes that were damaged by Cyclone Idai in order to motivate more farmers to venture into irrigation farming. Now, scores of farmers from Chamama Extension Planning Area in Kasungu who sold their maize to ADMAC have given the parastatal up to the 15th of this month to pay them or risk forcibly withdrawing their maize from the depot. Speaking to Zodiac on Tuesday, the farmers said they are failing to buy farm inputs and support their families due to the delayed payment. ADMAC spokesperson Agnes Chikoko told us she needs time to establish what actually happened. And now we move to sports. Football Association of Malawi says its affiliates should adapt to the use of modern technology in management of the sport. FAM Second Vice President Othani O'Hara made the remarks after the association donated laptops valued at 790,000 kwacha each to its 9 member associations, saying football is all about data and statistics, but the sport is lagging behind in managing data. Well, that item brings us to the end of the newscast. Before we go, let's look at the headlines one more time. Malawi Society of Medical Doctors support AstraZeneca vaccine administration. Clusters under COVID-19 response initiative present 6.2 billion kwacha funds expenditure reports. Lower Shire residents decry crops wilting due to prolonged dry spells. And in sports, FAM says its affiliates should adapt to the use of modern technology in the management of the sport. Even with me, Job Frank Jakaza, thanks for watching.